Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now let's have more discussion on RSV vaccine. It's a controversial vaccine. And why is this? Percentage risk of GB. That's any vaccine, but maybe this one's a little bit more, and we're still waiting on the data. Right now, it's only one vaccine. The second dose does not show an immune boost. So the CDC did make a change, and this is unusual for the CDC once they put a recommendation. They recommend all Americans aged 75 and older receive one dose of an RSV vaccine. Now, before we're kind of talking about 60 being the age, but now they're saying 60 to 70 with chronic lung disease, advanced kidney disease, and diabetes with organ damage. So why is this so important? Well, we know RSV is a bad player. And let's go back to some prior studies. Back in 2017, 2020, they followed hospitalizations and it was in New York State. It was a single county. And it talked about severe RSV. Okay. And they talked about patients who were community dwelling adults. Okay. And the hospitalization rate was between the ages of 64 to 74 was 91 per 100,000 and 191 per 100,000 for ages 85. But this is the key. If people were living in assisted living facilities, it was much higher than nursing homes. Nursing homes is 439 per 100,000 hospitalization. These are severe hospitalizations. Could result in death, but at least a long-term stay in the hospital. And it's 738 in assisted care living facilities. And you say, why would it be higher in assisted care? These are having ongoing contact with a wider community. They're going outside the community, coming into their community, and more mobile than a nursing home patient who has just limited contact with the staff, basically, maybe a couple people inside. So that's why it's so important. And if you work in a hospital facility, you realize how many patients come in the wintertime with RSV. And these are your sick players. These are your people that already have COPD, other forms of lung disease, kidney disease, and diabetes with organ damage. Now, so far the performance has been, it's harder to gauge. Now, it was effective against 77% of ED visits and 80% of hospitalization, but this fell to 50% after 19 months. So the RSV vaccine, it has great promise, and there's about 4 players out there right now, and maybe we need some little revisions on this. Is it a full-time player where you're going to have everybody get vaccinated on it? Not right now. So right now, this is important. The CDC did change the recommendation, age 75 or older, or 60 to 70 with these chronic conditions. And stay tuned. There'll be more updates on this.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.